If your child is born with a cleft lip and palate, do not focus on one doctor or one surgery. Choose the right team of doctors, because it is a multidisciplinary treatment where many doctors are involved. Choose the right team. Don't choose just one doctor. Namaskar parents. Today we are going to talk about what happens when a child is born with a cleft lip and a palate, that there is a gap between the lip, between the teeth and between the palate. There's a huge gap in the palate. Children who are born with cleft lip and palate are now diagnosed when they are in the mother's womb by sonography. So when the mother knows that the child is going to be born with a cleft lip and palate, the first person who comes in contact with the parents is the gynecologist and the neonatologist, and it is their job to counsel the parents that cleft lip and palate is completely treatable, and if done with the right team of the doctors, following the right timeline of procedures, the cleft lip and palate child will be leading a normal lifestyle as any other normal child. Now, the first job of the parent is to feed the child. It is very important that the child drinks milk, and how the child takes milk is not through breastfeeding, because there is a gap in the lip and there is a gap in the palate, that there is a communication between the oral cavity and the nasal cavity. As a result, the child cannot take milk how normal children take, and specialized feeding has to be done. That is, long nipple bottles come, which help the child directly swallow the milk, and the child has to be, when the child is being fed, the child has to be kept at a 45 degrees angle or at upright, so that the milk doesn't go into the nose. In these children, because there is a gap between the nose and the mouth, the milk frequently goes through the nose, and frequently these children have URTI, upper respiratory tract infections, that is cold, cough, maybe pneumonia also. The first surgery of the child is done at 3 months of age, that is when the child has 10 weeks of age, 10 hemoglobin and 10 pounds of weight, which is roughly 5 to 6 kilos. The cleft lip can be unilateral, that is, it is only on the one side, or it can be bilateral, that there is a small structure in between and there are two lips. And similarly with the palate, the midline bone is there and the palatal shells are on the other side. A bilateral cleft lip and palate is slightly more difficult to treat than a unilateral cleft lip and palate, but the timeline and the treatment remains the same. After the first surgery, that is the lip closure surgery, done at 3 months of age, the second surgery is done at 9 to 12 months, that is the palate closure surgery. This is done right before the child starts to speak. Now, once we address the feeding, the next function, it's very important for the child, is speaking. Once the palate has been closed, a palate surgery has been done, it is very important that the child undergoes aggressive speech therapy. Speech therapy is a must for the child to develop normal speech, because once just because the palate surgery has been done, the speech will not be normal. There has to be speech exercises by a professional speech therapist or a neonatal therapist who gives the child exercises so that all the words come out without any difficulty. Otherwise, certain words are missed by the child, and once the child learns wrong articulation and pronunciation and the child becomes an adult, then it is very difficult to correct the speech with surgeries. After the second surgery at 9 to 12 months of age, the third surgery is right at 7 to 9 years of age. In between that period, the child needs to undergo dental treatment by the periodontist or the orthodontist, where the upper jaw has to be expanded and it has to be protracted. Otherwise, because of the palate surgery, the maxilla or the upper jaw is very small. So at the age before the age of 7 to 9 years, the maxilla has to be expanded. At the age of 7 to 9 years, the surgery that the patient undergoes is known as bone grafting, because there is a cleft in the bone as well. There is a cleft in the lip, a cleft in the bone, the bone carrying the teeth, and a cleft in the palate. So for the cleft in the alveolus or the teeth bone, some bone is taken from the hip and it is put, and it is done at 7 to 9 years of age, so that all the clefts are closed. After this, the patient needs to undergo aggressive orthodontic treatment. So all the teeth are aligned of the upper jaw and the lower jaw. The upper jaw is forward and the lower jaw is backward, as it should be. In some cases, when right time treatment is not done, the upper jaw remains a little smaller than the lower jaw, and the lower jaw grows forward. In such cases, we have to do orthognathic surgery after the growth is complete. That is at the age of 16 to 17 years. After this, if required, the patient can undergo a revision lip surgery or a revision nose surgery, also known as rhinoplasty. That, if required, can be done at any age or once the growth is complete. Also, the patient needs to undergo ENT evaluation because of recurrent ear infection. The patient needs to undergo speech therapy, and dental treatment is extremely important. With this, the child, with teamwork and interdisciplinary management, the child can lead a normal and healthy life. If you have any doubts regarding what we discussed today, please send your questions on the above email ID or in the comment section below. We will definitely get back to you. Thank you.